My name is Kelsey Kossl. I'm one of the minimally invasive GYN surgeons. I'm one of the members of the Endometriosis Center here at NYU. And I'm so delighted tonight to be joined by our colleague Shouk Mansour. If you want to introduce yourself as well. Tonight, our topic is about nutrition and endometriosis. I'm so excited to dive right in.
Yeah, thank you so much, Dr. Kossl. I'm so excited to kind of join in and talk about something that I think a lot of women come in and ask about, which is how diet and nutrition can impact the way they manage and care for endometriosis. So I'm a registered dietitian and diabetes educator here within NYU Langone. So I'm definitely very happy to be joining in on this conversation to talk about, what does the literature out there say about how diet and certain lifestyle habits impact endometriosis.
Yes, thank you so much. I feel like I oftentimes am talking to my patients that endometriosis can be so challenging to treat. I often find that it is a multi-layered approach, between hormonal medication, surgery, pelvic floor physical therapy. And I have a lot of patients who ask me, what about diet? What about supplements? And they kind of want to know about that piece of the puzzle too. So that's why we are so excited to have this webinar.
Yeah, absolutely. And it makes sense. I think overall, more and more patients are coming in, no matter what condition they're presenting with. I think people generally speaking are growing more interest in, managing conditions in more of like a holistic, natural way, trying to learn about what are the things that they can do with their diet and with nutrition that can actually have an impactful it can actually impact their condition. And so endometriosis is certainly one of those. So I guess we'll kind of, get started and dive in. I know we have, I'm happy to answer any questions or kind of share the knowledge and literature out there about diet and supplement and how that impacts endometriosis.
Yeah, perfect. So for people who are joining us live, I have a list of questions for Shouk for sure. So we're going to dive into a few questions that I think hopefully will give a good overview. And then we will be keeping an eye on the chat. So if you have more specific questions, then please send us a chat message and we will get to those questions as well. From my point of view, I guess before I ask a question, just background for any patients who are listening. Obviously, endometriosis, we think of it as a condition that generates inflammation. I think that's going to be a key word to tonight's discussion. It's this kind of tissue that's located in abnormal areas, and as it gets stimulated by our hormones, it then leads to inflammation, which is basically a release of proteins that then can kind of have a negative effect, causing pain, causing other endometriosis related symptoms, such as our, gastrointestinal symptoms like nausea or diarrhea, constipation. And so I think that's kind of like the background of where hopefully the nutrition will tie in. And that would kind of come to my first question for you, which is, can you tell us a little bit more about how foods can contribute to inflammatory conditions in general?
Yeah, sure. So this is such a hot topic about food and inflammation, and it's certainly very valid. But I will say specifically when it comes to endometriosis, there's some literature about it, but it's not robust. So I just kind of like want to preface this that there's not like tons and tons of robust data and literature about it. So I just wanted to put that first and foremost out there. But yes, you know, kind of going off of what you were saying there with having an inflammatory condition like endometriosis and having those elevated proteins or cytokines, they are thought to be impacted by these inflammatory foods. So based on the current data and literature and studies that have been done, it's been shown that diets that are highest in trans fats and diets that are highest in alcohol and caffeine, red meat, and gluten, those are kind of thought to be some of the pro-inflammatory foods in the context of endometriosis, in that they promote the inflammation. So generally speaking, when I get patients with endometriosis, we'll talk about that kind of piece about those foods being pro-inflammatory and how to reduce them in the diet. I know for some people it may not be attainable to completely eliminate them, but if we can reduce them and see if there's any sort of positive impact on their symptom management, that is ideal.
Yeah. I love how you kind of led into this just by talking about the piece of, you know, what literature is out there. It's always so challenging in the world of nutrition supplements in terms of getting really rigorous, you know, research studies done or data. I took a look before our call tonight because I wanted to see, and I saw that at the very least there was, you know, one bigger study for any nerds out there, kind of what they call a meta-analysis, which is where they kind of pull together lots of studies so that even if, you know, those other studies were kind of small, we can gain information from putting them all together. And it showed exactly what you kind of just mentioned in terms of those trans fats and the red meat. What kind of food, just so we know, so in terms of these pro-inflammatory foods, what are specifically in terms of those trans fats, like what sort of examples of that would you give us?
Yeah, so trans fats are going to be found in mostly processed foods and fried foods, pastries, like cookies and crackers. Those are kind of going to be your highest sources of trans fat containing foods. So if you think about it, we should be avoiding them anyways for other reasons and purposes too. Also for blood sugar regulation, which I think is noteworthy to talk about as well, is that the other piece and kind of component that we really stress with patients in terms of management of endometriosis is managing your blood sugars, because it's thought that having a lot of blood sugar spikes in a given day will impact estrogen, and estrogen in turn impacts endometriosis. So anyways, a lot of these trans fat containing foods like, you know, crackers and cookies and pastries do cause a lot of significant glycemic variations and blood sugar spikes in a given day. So that's also something that's super key and important, is learning how to manage the diet in a way that you can stabilize your blood sugars.
Okay, perfect. Yes, that was definitely a topic I wanted to hit on as well. You know, when it comes to the drivers of our endometriosis, I think the inflammation is a big part of it. And then also our hormones. You know, there's a lot of talk about endometriosis and some of our other gynecologic conditions, that they are kind of coming from a place where potentially we have, you know, certain hormone imbalances, you know, estrogen and things kind of driving these conditions. So we want to see what kinds of food can also have a positive impact, I think, on just kind of getting us to some balance there. So you mentioned blood sugar control. So
Yes.
when we think about blood sugar control, there probably are some foods that are going to spike our sugars, and then some foods that are good at stabilizing our sugars. That's kind of the glycemic index, if I think of it correctly.
Exactly. Yeah.
Yeah.
Yeah. Pretty much. It's a super important concept to kind of have down that I like to explain to everybody because it's so relevant when it comes to endometriosis, or if you're somebody listening to this and you also maybe have like impaired fasting glucose or prediabetes, and you have like true issues with that, is learning how to pick the correct types of carbohydrates to keep your blood sugar levels steady here. So you definitely want to stay away from and be wary of those high glycemic index types of carbs, or what we refer to as white refined carbohydrates. So, it's things like white bread, pasta, cracker, cookies, soda, French fries, ice cream, sugary cereals, things of that nature. These are going to be the drivers of the blood sugar spikes. So what you do want to kind of focus predominantly on, and because inevitably we're going to be eating carbohydrates, that's just something that's, absolutely
Part of our life.
I always have patients that come and they're so carb phobic and they don't want to eat carbohydrates, but carbohydrates are an essential macronutrient. It's the brain's primary fuel source. We need it. We just need to be eating the correct type and the correct amount, and also pairing it appropriately, which is something that I'll also talk about that I think a lot of people don't think about, is pairing your nutrients together in efforts of keeping your blood sugar levels steady. So what I'm referring to there is pairing carbohydrates consumed with some sort of protein or fat, because carbs in general are, even if they're fiber containing, they're a pretty rapidly absorbing type of macronutrient. So by pairing it with a protein and or healthy fat, we kind of blunt that blood sugar spike from happening. So you kind of get a more stable or steady blood sugar response. And so that's also really important to think about here. So for example, combining like an apple with some nut butter, or, your bowl of oatmeal with some nuts or seeds, your toast with avocado, something of that nature. But let me go back to just steer back, because I kind of went on a tangent too about the types of carbohydrates. So I mentioned the high glycemic index carbs, and that they're kind of more likely to cause those blood sugar spikes. But we want to be focusing on those lower glycemic index carbs. So think about like the fiber containing ones. So they would be things like whole grains, sprouted grains, oats, steel cut oats, brown rice, quinoa, farro, berries, lentils, chickpeas, things of that nature. But keep in mind, if you are trying to consider, reducing gluten in your diet, which, like I said, gluten is possibly thought to be one of those components that may kind of promote or aggravate the endometriosis symptoms. You would want to be avoiding wheat, barley, and rye. So you got to kind of be careful with your carbohydrate selection there, and picking, kind of healthier gluten-free types of items like brown rice pasta or chickpea pasta, or things of that nature.
Okay, yeah, that's so helpful. It touches on kind of like multiple things coming together a little bit there. So that's really helpful. In terms of the idea of how our nutrition can impact our hormones, aside from foods impacting kind of the spiking of our sugars during the day, which can impact our hormones, we can also be exposed to just actually some hormones through our diet. Correct. And so what sort of foods should we be conscious of in terms of potentially having like added hormones in them?
Yeah, so that's a great question. So The biggest one would be soy and soy products, because soy is thought to impact estrogen and estrogen levels in the body. So I definitely will tell endometriosis patients to reduce their intake of soy, or if you are going to have it, I would recommend organic soy if you're going to have it in your diet, but definitely reducing your intake of soy. The other key concept is pesticides. There's some talk in literature about how pesticides in food can actually impact the hormones in the body, specifically estrogen, and then that can also impact endometriosis. So there's a great list that actually comes out each year. I don't know if people have heard of it, but there's two of them. They're referred to as the Clean 15 or the Dirty Dozen. So they test each year which fruits and vegetables have the highest levels of pesticides and which fruits and vegetables have the lowest levels of pesticides. So it can kind of give people kind of a clearer direction about what to buy organic and what you don't kind of have to worry about purchasing organic. Because I get it's not feasible to buy everything organic. It's expensive, it's costly, it's difficult to source, sometimes depending on where you live. So I definitely recommend taking a look at that, is just literally Googling Clean 15 and the Dirty Dozen. So that's super duper helpful. And then the other key big thing that I also tell people to really be more mindful about is dairy. That if you are consuming dairy, to try to get that organic, again, because of the added hormones in the non-organic dairy. So I usually actually tell people, if you're going to get anything at all organic, that it should be dairy, and it's because of the added hormones.
Okay, great. That's so helpful. As we kind of preface this whole conversation, we'll never have a study, that says like that one food in particular or something is the villain. But I think just for people where it's feasible and they want to kind of clean up their diet a little bit in terms of where they might be getting added hormones, or where where there might be certain chemicals or things that are kind of then impacting our own body's hormonal signaling. I think this is really helpful. There's probably so much more research to be done about this. I'm thinking over to our fertility colleagues, are kind of aware of and are trying to do more studies on exposures, in foods and other things that can then be kind of hormone disruptors. So hopefully we'll continue to get more information about this over time.
Yeah, like I said, there's not tons of robust literature about this. I think there's definitely a lot of room for growth when it comes to studying this and trying to understand how diet and nutrition can impact this. That's why also I really recommend and encourage women who come with endometriosis is to try to actually track their food intake and try to see how that impacts their symptoms. Because this is also kind of very specific to the individual. So for some women, they really benefit from eliminating, gluten or red meat or some of those kind of confounders that I talked about. And some really don't have any sort of improvement from eliminating those foods. So it's worthwhile to kind of track and kind of be more cognizant of how that impacts your symptoms. Also, just tracking your menstrual cycle is really key. So there's a lot of different ways to track this, just tracking it on your calendar, or there's a lot of great apps out there that can really make it easy and accessible for women to do this, or log symptoms and things like that. So I highly recommend that women do this.
Yeah. Yes, I'm a big fan, big proponent for any intervention that we're doing for endometriosis to kind of do use some sort of tracker or log for your symptoms. There's the Flow app on your phone. There's so many others that let you put in so much more than just pain or no pain. They can even let you put in what you ate that day, your activity level. And so that's really helpful. And because I think in all of this, we're trying to improve the symptom, right? And so the intervention can't be worse. It has to be better than, this for the symptom reduction. So for somebody, if eliminating one of these foods that we're talking about is going to be the end of the world to you, and you do it, and then you're not noticing a good bang for your buck in terms of symptom improvement, then you can maybe know that that's not the right path for you. Or if you eliminate a food that was really hard for you to eliminate, but you do get really great symptom reduction, then maybe seeing that through some sort of tracker, some sort of journal, I think can be really empowering that you're on the right path.
Sure. Yeah. Because sometimes, women will get really upset when I go over that list with them about these are the possible confounders, because gluten, red meat, are loved by a lot of women, I think.
Yeah.
So it can be really difficult and hard to eliminate them. That's why I usually will tell them just eliminate for even just a month or two, to see, is it worthwhile? Has it really had a huge impact on managing your symptoms? If so, great, keep trying to reduce it. If not, then, add it back in.
Yeah. I was going to ask how long. So like a month or two.
A month or two should be fine. Yeah. Most elimination diets will say at least just 1 month. And actually, now that we're kind of talking about elimination diets, just the idea came in my head about how there's a huge cross between endometriosis and IBS. So a lot of patients with endometriosis will also have irritable bowel syndrome. And so we'll oftentimes also recommend a different elimination diet called the FODMAP diet. And so this is completely different than eliminating those confounding foods that I mentioned earlier on this chat here. So basically, FODMAP diet is a short-term elimination diet whereby you're eliminating small, short-chain carbohydrates that are thought to be malabsorbed by the small intestine. So for some patients with IBS or bacterial overgrowth, like SIBO, for example, they benefit from reducing those types of carbohydrates for about a month. And then basically what you do after that is you slowly reintroduce each group of the carbohydrates one at a time and try to assess and see which one is triggering to your symptoms. So FODMAP is actually an acronym, if you want to kind of look this up and read more about it, but it stands for different groups of carbohydrates and carbohydrate types. So it's a pretty restrictive type of diet. So again, I really stress this with saying that do not follow a FODMAP diet for like more than a month and a half, because every so often I get people and they've been like following it for like a year. It's super restrictive. It's not like a lifelong diet. It's just, think of it as like a diagnostic tool to help yourself in identifying what foods may be triggering for you. But, so if you're listening to this and you think that that's something that you're interested in, I definitely advise you to consult with your doctor or healthcare provider or a registered dietitian about how to do this properly. Because like I said, it's pretty restrictive. So we don't want, too much unintentional weight, which sometimes can possibly happen. I see with people that follow this diet.
Okay.
Yeah.
That's super helpful, because when I was looking into nutrition with endometriosis, it comes up in hits. And as you mentioned, it is very restrictive. So I almost think, it's good to know about. I think that maybe for some patients who have started to work through some of these kind of pro-inflammatory foods, these
Yeah.
kind of potential, blood sugar spiking foods, and they're eliminating those, and maybe they're not getting the results that they need, and they have those crossover symptoms with IBS.
Yeah.
Then I think it's good to know that that is there and can be helpful. And to know what it is and that it's short term, because like you said,
Yeah. It's
talking about like totally cutting something out.
super hard. It's super
Yeah.
hard. It's a lot of things that you have to eliminate. And there's actually a great app for the FODMAP diet that can be great as a tool to help you track your food intake and to tell you which foods are high in FODMAP versus which are not. You can literally like scan food items and it'll tell you, and it's called the Monash University FODMAP diet app. It's such a helpful tool. I definitely recommend that if you're going to go that route and give that a try, is to download that app.
Great. All right. Well, I just have, I think, two more questions, and then we can kind of see where it takes us. We talked about pro-inflammatory foods. Are there anti-inflammatory foods? We're talking about a lot of foods to take out of our diet, but what are the foods that we're happy about? Are there any that can help us?
Sure. Yes. So we definitely know that foods that are high in omega-3 fats are thought to be anti-inflammatory. So omega-3 fats are going to be found in things like salmon, walnuts, chia seeds, flax seeds. Those are kind of going to be your best sources. So definitely adding those types of foods in the diet can be helpful, and or maybe consideration of an omega-3 supplement. So that's definitely something to consider. And the other is fiber and fiber-rich foods. So kind of thinking about adapting in the direction of a plant-based diet. So trying to incorporate more vegetables and fruits and legumes and whole grains. That is very helpful. And the other really important kind of anti-inflammatory compound is turmeric. Turmeric is great. We recommend turmeric for a lot of kind of inflammatory related types of disorders or conditions. So I will tell patients to cook with turmeric or to actually consider taking a turmeric supplement. But combining it with black pepper. So it's actually in pill form, it'll be turmeric with black pepper, or if you're cooking with it, to do turmeric and black pepper, because that just enhances the absorption. And then the other would be vitamin D. I know this is kind of, we're kind of talking about not just foods, but I figured also just like supplements as well that are anti-inflammatory. But vitamin D has been shown to reduce pro-inflammatory cytokines or proteins that are thought to contribute to the inflammation in endometriosis. So I definitely advise, if you are deficient in vitamin D, to take a vitamin D and take it with a meal. If you don't know your vitamin D level, please have your doctor, healthcare provider check it for you, because that's something also very important. So like in recap here, it's omega-3. So trying to eat the salmon, the walnuts, the chia seeds, more fiber-rich foods. So more of like a plant-based, plant-focused approach with the diet. And the vitamin D and the turmeric, I would say.
Perfect. That you mentioned kind of what was going to be my last question was supplements, which I think, so you covered a lot of supplements already. The other one that I was interested in your feedback on was magnesium. I just feel like magnesium is out there for a lot of different conditions now. It's supposed to help kind of promote muscle relaxation. So any thoughts on that or other supplements that we haven't mentioned so far?
Yeah, I get a lot of people that say that magnesium helps them if they have endometriosis, or just for women dealing with PMS, that magnesium can help with muscle relaxation and muscle contraction. So I would recommend magnesium. The turmeric is huge. I'm a big fan of the vitamin D. And that's pretty much it when it comes to my knowledge
Okay,
about that.
great. Well, thank you. That was so comprehensive. Does anybody who's joining us live have any questions that they want to write in the chat? We kind of have the beauty of having our expert registered dietitian here. If there's something that we didn't cover so far, just going to take a peek. I don't think I saw anything come into the chat yet. I did not. One thing I'll say while I give you guys a minute, if you want to write a question, you can. If not, we'll wrap up in the next few minutes. But I think what's so great, if anybody who's joining us live or who sees this recording is not yet kind of hooked into our endometriosis care companion, we're hopefully finding that to be a very resourceful tool for patients. Just, there's so much we try to cover in our visits with you, so much information we want to share, and it's so individualized patient to patient. So we have kind of developed resources that we've put into this care companion. It sends information to you through your MyChart app. And if it disappears, if you kind of saw some information and now it's not there on your home screen, it still lives on in your care companion. It's, I think, somewhere in the menu section under patient information, education. So those documents are there for you. And we're really excited that we're adding one on nutrition that it goes through so many foods. So appreciative for your help in making it. So hopefully it can kind of be a tool if patients want to start making some changes. And then also we have Shouk available as our registered dietitian for consultations. I do refer people. So if you're seeing myself or you're seeing one of the other members of our endometriosis center, you can just ask for a referral and we put that electronic order in, and then you can set up an appointment. So we're really just lucky to kind of have these resources all tied in together with our endometriosis center.
Definitely. And I'm more than happy to be part of it and to kind of facilitate the conversation about nutrition in this context.
Yeah, perfect. Well, this was such a wealth of information. I'm super excited for this to be available to everybody online. And for it to be a good jumping off point, I hope, for patients so that they can start making some changes and see that if it hopefully positively impacts their endometriosis symptoms.
Perfect.
Right. Well, I don't think we saw any questions come through yet. So I think we are going to wrap up a couple minutes early. Thank you everyone so much for joining us. And thank you so much, Shouk.
Sure. Thank you so much, Dr. Kossl. Thank you, everyone. Take care.
Have a good night.